Menstrual Disorders by Megan Smith. Menstrual disorders are problems related to menstrual cycles that affect physical, emotional, and reproductive health. And a few that I'm going to talk about today are amenorrhea, dysmenorrhea, mid-menstrual cycle pain, premenstrual syndrome, menopause, endometriosis, as well as premenstrual dysphoric disorder. Amenorrhea is the absence of menstruation, and it is classified into primary and secondary. In primary, you have no menses by the age of 16, and some risk factors are genetic and anatomical conditions, Turner syndrome, anorexia, and PCOS. Then you have secondary, and secondary is the cessation after puberty for more than 3 cycles or more than 6 months. And some risk factors for secondary are pregnancy, that's actually the number one, hormonal imbalance, pituitary and hypothalamic disorders, too much exercise, anorexia, bulimia, breastfeeding as well can cause absence of menstruation, menopause, and we will get into menopause a little bit later, increased BMI, and decreased body fat. Now, some diagnostics are going to be things like a pregnancy test, hormone panels, or imaging. Our nursing care, we're really going to focus on counseling, letting the patient know about nutrition and exercise education, as well as hormone therapy as ordered. We're going to reassess and monitor for menses. We're going to monitor the patient's weight and their nutrition status and their hormone levels. Some expected outcomes are going to be that the patient resumes their normal menstrual cycle or achieves hormonal balance, and that they understand fertility implications. Dysmenorrhea is painful menstruation due to increased prostaglandin release, and it's also classified as primary or secondary. Primary occurs 6 months after your menarche, and then secondary is caused by pathological condition of pelvic cavity, such as endometriosis, infection, cervical stenosis, tumors, fibroids. The management of dysmenorrhea, the patient's going to take NSAIDs. They can use a heating pad on their pelvic area where they're having that pain. They're going to need a pelvic exam, possibly hormonal contraceptives, and a laparoscopy or an ultrasound if it's severe. Some nursing care, we're going to teach lifestyle changes, pain relief strategies such as NSAIDs. We're going to teach them to avoid caffeine, salt, alcohol before the onset of menses, as well as encourage a low-fat diet with natural diuretics such as watermelon and cucumbers. You're going to reassess for pain relief and make sure that the NSAIDs are working. And then the hormonal therapy, as well as reassess impact on daily activities. Your expected outcomes are going to be that the pain is reduced and manageable. Patients are going to verbalize effective coping strategies. Mid-menstrual cycle pain, or Mittelschmerz, comes from the German words middle and pain. It's defined as ovulation pain occurring mid-cycle. Some symptoms are unilateral abdominal pain, mild to severe. Diagnostics are going to be symptom timing, and if severe, they can do an ultrasound or a CT to rule out an ovarian cyst. Management's going to be NSAIDs and acetaminophen. Nursing care, reassurance, and symptom tracking. So when we reassess, we're going to track the timing of the pain with the cycle, and we're ruling out cyst if pain worsens. Our expected outcomes are going to be that the patient recognizes the pattern and that they're able to manage the pain with over-the-counter meds, as well as reporting anxiety about symptoms. Premenstrual syndrome, or PMS, is the recurrent physical, emotional, and behavioral changes in the luteal phase of cycle that interfere with interpersonal relationships and normal activity. It's an imbalance in estrogen and progesterone. The symptoms subside with menses. Some of the symptoms are irritability, mood swings, bloating, breast tenderness, cravings, headaches, aches, and pain. Management is going to be lifestyle changes such as exercising, diet changes, and stress reduction. You're going to encourage healthy foods such as vegetables, fruits, and whole grains. You're going to let the patient know to take NSAIDs. Diuretics might be a possible management, as well as antidepressants to manage those symptoms. Nursing care, you're going to teach journaling, symptom tracking, stress management. Let the patient know to avoid salt, high sugar foods, and alcohol when they're feeling the symptoms because those can exacerbate them. You're going to reassess and monitor severity of mood changes, any fluid retention, and lifestyle adherence. Expected outcomes are patient reports improved stability, less bloating, and effective use of coping strategies. Some nutritional supplements studied for effectiveness are calcium to relieve depression, magnesium to relieve headaches, and vitamin B6 may relieve moodiness, anxiety, and bloating. Premenstrual dysphoric disorder, or PMDD, is a severe form of PMS with marked emotional disturbance caused by serotonin response to estrogen levels during cycle. Some symptoms are irritability, anger, anxiety, hypersomnia, insomnia, appetite changes, and decreased interest in activities, as well as bloating. Medical management usually begins with ruling out other medical conditions that could cause the symptoms, and some laboratory studies would include thyroid function tests, a CBC, and FSH levels. Treatment for PMDD is similar to the treatment of PMS. It just focuses more on medications, and some medications are going to be like hormone therapy, including drospirenone and estrogen, antidepressants, anxiolytics, cognitive behavioral therapy, relaxation techniques, as well as acupuncture. Some nursing care is going to be to support the coping strategies and encourage therapy adherence. You're going to reassess the emotional symptoms after therapy as well as monitor the medications. You're going to monitor for side effects as well as sleep and appetite changes. And our expected outcome is going to be that the patient demonstrates improved functioning at school, work, with reduced irritability and better interpersonal relationships. Endometriosis is when the endometrial tissue grows outside of the uterus, and it's common among women in their 30s and 40s. The cause is unknown, but it can cause symptoms such as painful cramps, chronic back pain, dyspareunia, painful bowel movements, spotting between cycles, nausea, vomiting, diarrhea or constipation, and bloating. Some diagnostics would be things like a pelvic exam, an ultrasound, MRI, or a laparoscopy. Management, there is no cure for endometriosis. However, extended cycle oral contraceptives may be prescribed to reduce the number of menstrual periods, as well as surgical removal of tissue. Nursing care is going to focus on pain management, education, and emotional support. When you reassess, you're going to monitor pain levels, bleeding patterns, and fertility status after treatment. Expected patient outcomes are going to be that their pain is decreased, they have an improved quality of life, and that patient verbalizes an understanding of long-term management. And lastly, we'll discuss menopause. Most women experience menopause between the ages of 40 and 58, but the average age is 51. And menopause is the permanent cessation of menstruation, and it's confirmed when the woman does not have her menstrual cycle for 12 consecutive months. Symptoms can include hot flashes, night sweats, mood changes, vaginal dryness, sleep disturbances, a decreased libido, an increased risk of osteoporosis, as well as cardiovascular disease. Management will include hormone replacement therapy with estrogen, and Healthcare providers usually begin with a low dose patch, but it's also available in creams, gels, sprays, and vaginal rings. Calcium and vitamin D supplementation, weight bearing exercise, smoking cessation, stress reduction, lifestyle changes. SSRIs are often prescribed to treat depression and control hot flashes. Some SSRIs would include paroxetine and fluoxetine. For hot flash control, they might prescribe gabapentin or clonidine and intravaginal DHEA to manage the dyspareunia. And that's an inactive steroid that is converted into estrogens. Nursing care for menopause is going to be education on bone health, nutrition, exercise, symptom management, emotional support, sexual health counseling, and monitoring for depression or anxiety. There was a study in 2018 that showed lavender aromatherapy decreases menopause symptoms when inhaled for 20 minutes 2 times daily. The lavender aroma. Some reassessments that we're going to focus on are monitoring bone density, cardiovascular risk factors, and symptom relief with hormone replacement therapy and lifestyle changes. Our expected outcomes are going to be that the patient reports reduced vasomotor symptoms, maintains bone health, and demonstrates knowledge of self-care strategies. And now that we've learned about some menstrual disorders, I have two NCLEX questions. Question number 1. A nurse is caring for a client newly diagnosed with PMS. Which of the following nursing actions should the nurse include in the teaching plan? Select all that apply. A. Encourage the client to decrease caffeine and sodium intake. B. Recommend a diet high in refined sugars for energy. C. Teach the client to exercise regularly. D. Suggest journaling and stress reduction techniques. E. Encourage increased water intake if not contraindicated. The correct answer to question number 1 is A, C, D, and E. The rationale is decreasing caffeine and sodium reduces fluid retention and irritability. Regular exercise improves mood stability and decreases PMS symptoms. Journaling and stress reduction help manage emotional symptoms. Adequate hydration supports overall health and reduces bloating. B was incorrect because refined sugars worsen PMS symptoms. Question number 2. A nurse is reviewing expected findings for a client experiencing menopause. Which of the following should the nurse anticipate? Select all that apply. A. Increased estrogen levels. B. Report of hot flashes. C. Report of mood swings. D. Report of dyspareunia. E. Decreased LDL cholesterol levels. The correct answers to question number 2 are B, C, and D. The rationales are hot flashes are hallmark vasomotor symptom of menopause due to decreased estrogen. Mood swings are common with hormonal fluctuations. Vaginal dryness and dyspareunia occur from decreased estrogen. A is incorrect because estrogen levels decrease, they do not increase. And E is incorrect because LDL cholesterol typically increases with menopause. So, in conclusion, menstrual disorders affect physical, emotional, and reproductive health, and nurses play a key role in assessment, education, and supportive care. Early recognition and management improve quality of life and fertility outcomes. Here you'll find my references. Thank you.